Welcome to part 2 of the lecture on spirituality and patient-centered care. In part 1, we discussed patient-centered and whole-centered care, religion, spirituality, and the beliefs that our patients have about spirituality. This lecture will focus on the spiritual assessment and introduce you to the FICA or FICA tool. So what should the role of spirituality be in medical practice? Well, as clinicians, we should aim to understand the role of spirituality in our patients' lives. We should identify spiritual distress, provide an opening for spiritual care, and to use available resources to provide specialized or customized spiritual care. Access to things like a chaplain, a religious leader, time for ritual. These are things that we should consider. In 1999, the Joint Commission on the Accreditation of Healthcare Organizations issued the following standard. Spiritual assessment should be performed on every patient identifying at minimum, the patient's denomination, beliefs, and spiritual practices. And in addition to the spiritual assessments, healthcare organizations, particularly hospitals, should provide their patients with access to pastoral services. So what is spiritual assessment? It is a system or an approach that provides understanding of the patient's spiritual and religious beliefs, values, and needs. The assessment includes questions about the patient's beliefs, use of religion, religious and spiritual concerns, and the persons that they would call upon if someone like a spiritual counselor. Spiritual assessment should be performed as part of the full H&P, the full history and physical, in the social history section. They should also be performed during hospital admissions, advanced directive discussions on long-term care, and end-of-life decision discussions. The spiritual assessment tool that we'll be using is known as FICA. It was developed by Dr. Christina Pacholski, and FICA stands for Faith, Importance, Community, and Address. It focuses on the spiritual, and thus it's open to answers about one's religions. So the FICA is the spiritual history-taking tool, and it's used to guide the clinician in discussing spiritual issues. So let's start with F. F is for faith, belief, or meaning. Questions to consider or questions to use are, do you consider yourself spiritual or religious? Do you have spiritual beliefs that help you cope with stress? What gives your life meaning? These questions are open enough that religious patients will identify with those questions, and those who are not religious but are spiritual can also identify with those questions. Those who are neither may answer with a no, particularly for the first two questions. The third question, what gives your life meaning, may be answered with things like my children, plants, or nature, and this may or may not have a spiritual content to it. I is for importance and the influence of spirituality. It assesses how a person's spirituality affects his or her life. Questions like, what importance does your faith or belief have in your life? On a scale of 0 to 5, how would you rate the importance of faith or belief in your life? With 0, of course, being not important at all, and 5 being highly important. These first two questions directly get at the importance of spirituality, while the last two look at the influence of spirituality specifically on stress and decision making. C is for community. This is an assessment of both the external expressions of spirituality as well as possible spiritual supports for the patient. So the questions are you part of a spiritual or religious community? And if so, is this of support to you, and how? Is there a group of people that you really love or who are important to you? A stands for address or application and care. These questions assess how we as clinicians may be able to help. So as your clinician, how would you like me to use this information as I care for you? Is there anyone else who you'd like to speak with about this? This way the person can tell you who else is important to be involved in this process, both whether in their family or within their religious community or spiritual community. Possible actions that we as clinicians can take are making a referral to pastoral care or to a spiritual leader, um, providing opportunities for rituals, including prayer and services, facilitating space for a spiritual support community, even non-traditional things like music or storytelling or recording or just space for solitude. How do we document the spiritual assessment? Well, the social history is a natural place to document this. Now, if a spiritual issue is contributing to an acute visit or is the main reason for the visit, it should be documented in the HPI or in the subjective section of the SOAP note. In the treatment or plan section, you can put your A from the FICA or how you're going to address the spiritual issues. Now, most hospitals have a spiritual care section of the chart, and clinicians should review that section regularly as a part of the patient's care. The goals of spiritual assessment are really twofold. One is to identify the spiritual needs, and two is to coordinate resources to help address those needs. Now, the spiritual assessment may be the intervention, particularly for patients in palliative care or at end of life. The spiritual assessment may be the therapeutic intervention. Many times, giving patients the opportunity to talk about their spiritual concerns is all that's needed. So performing a spiritual assessment can build rapport with the patient. It can help them in coping with their illness. It can increase compliance, provide treatment effectiveness. These are results that can occur from doing a spiritual assessment. Attaining the assessment early may save you the time you need in the long run. Trying to get an assessment during a crisis can be quite difficult. So remember, FICA, FICA, faith, influence or importance, community, address or application or action. Cure sometimes, relieve often, comfort always. Thank you.